The Washington Medical Coordination Center is based here at Harborview. It's about resources, space, staff, and stuff. What happened to hospitals during the spring COVID wave may be just a preview of what we can expect to hit the Northwest come January, February, and March. Will there be enough ICU beds? Will there be enough doctors, nurses, and other staff to take care of us? And this is one thing making hospital administrators nervous. The latest projections from the UW's Institute on Health Metrics and Evaluation finding that at its peak in late February, the state could need 667 ICU beds. There are only 341 available statewide where things stand now.
And that's our big concern, because as you look at the IHME projections, then you begin to really see a constrained system where incredibly hard choices may have to be made.
Dr. Steve Mitchell heads an organization which is playing a critical role in managing COVID's impact on the state's hospitals. It's called the Washington Medical Coordination Center, and it's located at Harborview. Already, the state's hospitals are trying to make room by rescheduling elective surgeries like knee replacements and the reestablishment of field hospitals like we saw in the spring.
And so it's all part of a kind of a stair-stepped progression as the disease burden increases.
And then there's this. Harborview is the only level 1 trauma center in the region serving patients from the Northwest and Alaska. But what happens when those states are being overwhelmed with their own COVID patients?
When those options aren't available to people locally, we are asking states to take care of COVID patients within their state. Once they have exhausted their state resources or ability to place that patient, then we would get involved.
We cannot have people dying in the parking lots of our hospitals.
Governor Jay Inslee again urging people not to gather to keep hospitals from running out of rooms and staff.
Unless something changes, we very well could be in a situation with catastrophic loss of medical care in the state of Washington. Now, the Coordination Center works with the governor's office through the State Department of Health, trying to keep us from reaching those critical levels. At Harborview, Glenn Farley, King 5 News.